Revolutionizing Bleeding Management with the Quantra System.
Hi, my name is Asad Shah. I'm a cardiac surgeon at Hoag Hospital in Newport Beach, and I'm the chair of the Department of Cardiac and Thoracic Surgery.
Dr. Shah, how does bleeding impact your cardiac patients and surgical care team?
Bleeding remains one of the most difficult things to manage in cardiac surgery. Despite all the advances in technology and improvements in patient care, even the most routine of open heart surgeries still has to deal with the issue of bleeding. So bleeding has a lot of negative consequences for our patients, both in the short term and over the medium to long term. Aside from the obvious issues of blood product utilization, some patients have to go back to the operating room for bleeding. Some patients develop pleural effusions or blood around the heart or lungs. This can sometimes result in irregular heartbeats. Obviously, there's significant cost associated with this, increased length of ICU stays and hospital stays overall, and oftentimes a variety of unnecessary tests, meaning more x-rays, more echoes, more lab tests. So it can be pretty detrimental to patient care, difficult for the hospital and surgeon to deal with as well.
Thank you, Dr. Shah. What led you to consider viscoelastic testing for your cardiac surgery program?
Our group was looking for a new point of care test to help us manage bleeding in cardiac surgery patients. We had previously used the TEG.
Tell us about the testing. Who runs the tests and when?
On a day-to-day case, we start off by having our perfusionists run a Quantra before the case starts, and they relay that information to the team during the timeout. So that gives us a heads up if there are any significant deficiencies in the clotting factors or platelets, and then we would have those ready to give the patient at the end of the case if needed. The second point in time we check the Quantra is typically when the cross clamp comes off of the aorta, so kind of towards the middle to end of the case. And the main thing we're looking for there is how much of a drop there was in the strength of the clot. Then lastly, at the end of the case, once the protamine has been given, we check another Quantra to see if there are any other deficiencies.
Could you share some of the benefits you've experienced?
Since we've started using the Quantra, I think we've seen benefits across the board in all aspects of patient care after heart surgery. Probably one of the biggest things is that we see we're able to more specifically tailor the blood products we give to patients who are coagulopathic. And so instead of doing a shotgun approach where we're giving every patient a round of products, 2 rounds of products, and hoping that the bleeding stops, we're able to actually diagnose and find the issue with the coagulation system and target that specifically with whether it's platelets, FFP, protamine, cryo, and so forth. And I think overall that's resulted in patients overall getting less blood products transfused and less return trips to the operating room for bleeding because we're able to catch it early and target it very specifically. In terms of complications, since we've started to use the Quantra, we've developed 3 stars from the Society of Thoracic Surgeon for aortic valve replacement, coronary artery bypass grafting, and mitral valve repair and replacement. And of course, it's hard to attribute that to one specific thing, but I think using the Quantra has made our overall outcomes much better in terms of length of stay, avoiding takebacks for bleeding, avoiding long ICU stays, effusions, and just kind of massive transfusion in a lot of patients.